Okay, so in today's integrated reproductive health revision, we are looking at the past paper for May 2022. We'll go straight to the multiple choice questions. The first question says, in the provision of the 8 antenatal contacts, the woman who comes for antenatal care is considered to be a dash in the healthcare system. The answer is C, which is partner. 2. When providing the antenatal booking to a prime gravida, the nurse is expected to communicate professionally in order to, the answer is D, create rapport and a trusting relationship. Question 3. According to the antenatal care guidelines, the woman who is HIV positive and has been commenced on cotrimoxazole prophylaxis should receive. The answer is B, which is no dose of Fancida. Question 4. Masiliso, a 16-year-old prime gravida, comes for her second antenatal contact at 20 weeks, 6 days, and presents with hypertension and severe headache for the first time. Urinalysis findings indicate no abnormalities. Masiliso has, the answer is B. The answer, of course, for 4, the answer is B, which is gestational hypertension. 5. HELP syndrome is characterized by, the answer is D, which is red blood cell destruction. 6. For question 6, the endothelial damage that characterizes preeclampsia leads to, the answer is B, which is increased permeability of blood vessels. 7. The most definite treatment of severe preeclampsia is, the answer is B, which is terminate the pregnancy. 8. The motorbike campaign for accelerated reduction of maternal mortality in Africa is, the answer is A, no woman should die while giving life. 9. You are examining the lower limbs of a pregnant woman. Which one of the following findings will make you suspect deep vein thrombosis? The answer is B, which is calf tenderness and warmth. Question 10. When the long axis of the fetus lies parallel to the long axis of the maternal uterus, the lie is called, the answer is A, which is longitudinal. Question 11. In eclamptic fits, when the whole body becomes rigid and the patient becomes cyanosed, this is referred to as, the answer is D, which is tonic stage. 12. Which one of the following is a correct combination of the 4 P's that affect the course of labor? The correct answer is A, which is power, passage, passenger, and of course, personality. Question 13. Which of the following structures is used to assess adequacy of brim on the pelvic assessment during vaginal examination? The answer is C, which is the sacral promontory. 14. Which one of the following features on the pathograph falls under the component of maternal well-being? The answer is C, which is proteinuria. 15. The uterus is situated dash to the urinary bladder. The answer is D, posterior. 16. The cone-shaped device used in obstetrics to check for the fetal heart rate is known as, the answer is of course D, which is the Pinard's stethoscope. 17. In order to reduce perinatal mortality, a pregnant woman is normally recommended to have a minimum of dash antenatal contacts. The answer is D, at least 8. 18. On the pathograph, a contraction that lasts between 20 to 40 seconds is shaded using, the answer of course is B, which is diagonal lines. 19. Megaloblastic anemia predisposes to abruptio placenta by, the answer is D, weak vessels detaching from decidua. 20. Puparium normally lasts for a total of dash days. The answer is A, which is 42, approximately 6 weeks. 21. Which one of the following is not a physiological change in the first stage of labor? The answer is D, significant fall in blood pressure. 22. The pH of the vagina during pregnancy is between, the answer is C, 3.5 to -6. 23. The uterus rises out of the pelvis and becomes an abdominal organ at about, the answer is D, which is 12 weeks of pregnancy. 24. Which of the following does not predispose to abruptio placenta? The answer is A, external cephalic version. 25. Physiological anemia in pregnancy occurs as a result of, the answer is D, increased plasma volume. 26. The myometrial muscle that plays a major role in arresting hemorrhage during puerperium are the answer is C, which is oblique muscles. 27. The condition in which the fundal dominus is lost and the contractions start and last longer in the lower uterine segment is known as the answer is C, which is reversed polarity. 28. Incomplete or delayed return of the uterus to its pre-gravid size during puerperium, usually due to retained product and infection, is called, the answer is D, subinvolution. 29. Blood pressure in normal labor should be checked every, the answer is B, 4 hours. 30. The portion that develops into the lower uterine segment together with the cervix is the answer is C, isthmus. 31. The nurse midwife performs a physical examination of the abdomen in the pregnant woman as part of the routine checkup. Which one of the following physical examination technique is not routinely used by the nurse midwife? The answer is D, which is percussion. 32. The internal structure of the female genitalia include, the answer is B, which is fimbria. 33. One effect of a cord measuring about 25 centimeters during pregnancy and labor is, the answer is B, which is called prolapse. 34. A normal neonate is one born as spontaneous vaginal delivery with vertex presentation with the gestational age of, the answer is C, which is 37 complete weeks. 35. Which of the following diseases is not prevented by use of iron and folic acid supplementation during pregnancy? The answer is B, which is malaria. 36. The purpose of a tetanus diphtheria vaccine injection that is given to women during antenatal care is to, the answer is B, provide active immunity against neonatal tetanus. 37. The woman comes for her antenatal contact at 34 weeks gestation. The next contact for antenatal will be conducted at, the answer is D, 38 weeks. Question 38. The appropriate action for nurse midwife to take if a pregnant woman comes for the antenatal booking without the spouse is, the answer is B, attend to her and explain the importance of male involvement. 39. The main reason why a nurse midwife should always inquire how a woman is feeling before commencing antenatal booking is to, the answer is D, rule out danger signs that require immediate attention. 40. When performing abdominal examination on a pregnant woman, the answer is D, the woman should empty the bladder prior to the examination. 41. In which of the following fallopian tubes does fertilization take place for a normal pregnancy to be achieved? The answer is A, which is ampulla. 42. The chorion, and the answer is C, is the outermost embryonic membrane. 43. The overlapping of the cranial bones of the fetus to allow smaller diameters negotiate the pelvis during childbirth is called, the answer is C, which is molding. 44. When the baby is delivered, the cord should be clamped, secured, and cut. The answer is C, 2 to 3 minutes after delivering to allow fetal blood in the cord to go back to the baby. 45. The APGAR score is a tool used to assess. The answer is A, general condition of the baby after birth. 46. Which one of the following interventions will help the nurse prevent heat loss by evaporation immediately after delivery? The answer is D, wipe the amniotic fluid and other fluids thoroughly off the baby's body. 47. The hormone that is responsible for production of breast milk is, the answer is D, prolactin. 48. Which one of the following is a reproductive health right? The answer is C, right to lead a responsible and satisfied sex life. 49. Which one of the following is the most definite way of preventing HIV infection? The answer is A, which is abstinence. 50. Which one of the following interventions is appropriate for a pregnant woman who tests positive during antenatal visit? The answer is A, commence her on triple antiretroviral regimen irrespective of the CD4 count or World Health Organization staging. Okay. The next set of questions is matching. And it says match the obstetric syndrome in column 1 with their cause in column 2. So we start with 51. 51 says covered syndrome, and the answer is B, which is sympathy for pregnant partner. 52, HELP syndrome, the answer is E, which is complication of severe preeclampsia. 53, Down's syndrome, the answer is A, which is a baby born with an extra chromosome. 54, carpal tunnel syndrome, the answer is G, which is compression of the median nerve in the arm. 55, supine hypotension syndrome, the answer is F, compression of the inferior vena cava. We move on to the next set of matching. It says match the probable sign of pregnancy in column 1 with their description in column 2. And 56 says Hager's sign. The answer is E, which is elongation and softening of the isthmus. 57, Jacquemeyer's sign. The answer is C, which is increased pulsation in the lateral fornices. 58, uterine sulfur. The answer is B, which is the sound of maternal blood as it passes through large vessels. 59, Oshenda's sign. The answer is A, which is bluish or purplish discoloration of vagina and cervix due to increased blood supply. 60, uterine enlargement. The answer is F, which is increase in the size of the uterus. The next set of matching says match the contraceptive methods in column 1 with the time when they start to work in column 2. 61 says intrauterine contraceptive device. The answer is B, immediately. 62, microgynon. The answer is F, which is after 7 days. 63, lactation amenorrhea method. The answer is B, which is, of course, the answer is E, of course, after 48 hours. 64, condom. The answer is D, which is during sex. 65, vasectomy. The answer is, of course, A, which is after 24 hours. Okay, so that is about this set of matching. So for vasectomy, okay, 66. The next set of matching says, match the terminologies used in sperm analysis in column 1 with their meaning in column 2. And 66 says azoospermia. The correct answer is D, which is no sperm in the ejaculate. 67, oligozoospermia. The answer is C, which is decreased total number of sperms in ejaculate. 68, asthenospermia. The answer is E, which is decreased percentage of motility. 69, hypospermia. The answer is G, which is decreased semen volume. 70, hematospermia. The answer is A, which is presence of blood cell in semen. We move on to completion, and in completion, 71 says provision of healthcare interventions to women and couples before conception which occur in order to increase the chance of having a healthy baby is termed. The answer is preconception care. 72, pigmentation of the facial skin in pregnancy is called. The answer is chloasma. 73, a dash is a chart in which salient features of labor are entered in graphic form and provides the opportunity for early identification of abnormality. The answer is pantograph. 74, a woman who has never been pregnant before is referred to as. The answer is nulligravida. 75, dash is an occasional complaint in pregnancy caused by stimulation of salivary glands due to ingestion of starch. The answer is pituitalism. 76, if the total amount of liquor exceeds 1,500 mils, the condition is known as. The answer is, of course, polyhydramnios. 77, dash is the term given to a woman who has had 5 or more viable pregnancies. The answer is grand multipara. 78, failure of the uterus to contract with normal strength during an interval of contraction is called. The answer is uterine inertia or hypotonic uterine action. 79, the relaxation effect of progesterone on the cardiac sphincter predisposes a pregnant woman to. The answer is acid reflux or heartburn. 80, dash is the antidote for magnesium sulfate. The answer is calcium gluconate. 81 says the type of pelvis characterized by sharp ischial spines, narrow forepelvis, and straight sacrum is called. The answer is android pelvis. 82, a woman who has lost her newborn can be given a drug called dash to suppress lactation. The answer is carbamazole, also known as bromocriptine. 83, the branch of medicine that deals with care of women during pregnancy, childbirth, and the postpartum period is called. The answer is emergency contraception. The answer is obstetrics rather. 84, the postcoital oral contraceptive pill is an example of, and this one is the one where you say emergency contraception. 85, the ejection of the seminal fluids from the male urethra at the height of the sex act is called. The answer is ejaculation. 86, Mrs. Sakala, who is breastfeeding her baby aged 1 year, comes to access family planning. She wants to have another child after 2 years. She will be profiled as A. The answer is, of course, spacer. 87, the counseling, which is profile 2 spacer, of course. Then 87, the counseling of a woman and her partner for a family planning is termed. The answer is couple counseling. 88, the total inability to conceive is called. The answer is sterility. 89, 89, the sac that holds testicles in a male reproductive organ is called. The answer is scrotum. 90, The procedure in which a peritoneal fluid is obtained from the cul-de-sac of the female patient is called, the answer is kudocentesis. 91. An acute, subacute, recurrent, or chronic infection condition of the pelvic cavity that involve inflammation of the fallopian tube is called, the answer is salpingitis. 92. An acute, subacute, okay, so 91 is salpingitis. Then 92, the answer is ophthritis. 93, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters related to the reproductive system and to its functions and the processes called, the answer is reproductive health. 94, the hormone that the antigen in Gravindex slide targets during Gravindex test is called, the answer is human chorionic gonadotrophin. 95, an operation performed in the abdomen or pelvic through a small incision with the aid of a camera is called, the answer is laparoscopy. 96, an infertility test that shows whether both fallopian tubes are open and patent, and the answer is hysterosalpingography. 97, painful and uncomfortable sexual intercourse is referred to as, the answer is dyspareunia. 98, a congenital abnormality of the genital tract where the uterus has two cavities is called, the answer is uterus didelphys, also known as biconjugate uterus. 99, a couple where one partner is HIV negative and the other is HIV positive is known as, the answer is discordant couple. 100, the concept of giving antiretroviral drugs to HIV negative individuals to prevent them from acquiring HIV is termed as, the answer is pre-exposure prophylaxis. So this paper had essays to do with third stage of labor, and the other essay to do with septic abortion, and the third essay to do with PID. So that's all for today's revision. Till next time, goodbye.